Welcome back to another episode of the Eat Well, Be Well Nutrition Podcast. I'm Hannah Grunwald, a registered dietitian at Meridian, and I have a special guest with me today, Dr. Carla Watson. Hi, Dr. Watson.
Hello. Thank you for having me.
Yes, Dr. Watson, you are a medical director and physiatrist at Meridian. Tell me a little bit about how you got into that role. What is a physiatrist, and what do you do at Meridian? How do you support members?
Well, I am a board-certified physiatrist, which we're board-certified in physical medicine and rehab. And I basically tell people that is the doctor for people who have a disability, whether it's temporary or permanent. The disability is typically what we treat. And if you think about people with disabilities, you truly do have to manage their care. And for those with permanent disabilities, it's pretty lifelong. So translating that into getting my patients access to care, I then came to the health plan side to then start working on assisting with access to care, but being able to help more people on a daily basis.
I see. Well, I'm glad you're here today because we have had a listener ask a question. So they reached out through our email and said, help, I need some support. I'm trying so hard to get my blood sugar under 100. I feel like I'm being so restricted with my food. I can't have any of the things that I like anymore. It just kind of feels like I'm spinning my wheels. Can you help us?
Sounds very familiar. I actually, years ago, was starting to see younger patients that were having more issues with things like stroke or diabetes or complications of diabetes, whether it's kidney disease or losing a limb. And it just started to dawn on me that people really don't have the information they need to potentially, there's some things you can control, there's some things you can't, but the things that you should control or can control, if you started on the front end with more prevention, then maybe you might have tools to, if not help prevent the disability, but also help educate you on how to handle it. So I actually started a wellness center years before wellness was a true buzz term, but the goal really was to educate people on how to change their lifestyles, how to address knowing their numbers, and how to stay ahead of the game, even if you had a family history or if you had risk factors that you couldn't control, to really be in charge of their health.
Yeah, and it sounds like physiatry really focuses on the whole person, the whole body health. So it's maybe not just, like for this listener, it's not just the type of food, it might be the timing of food, or it might be how they pair movement with that, or how they manage other parts of their life.
Correct. You know, it is often that people get focused on one number. It is great to know your numbers, whether that's your blood sugar, your hemoglobin A1C, or your blood pressure, but sometimes you have to take the focus off of the number and actually look at things that also could influence the numbers, such as your activity, the amount of sleep that you're getting, managing your stress, all contribute to what's going on inside of your body. So people tend to focus on one thing and think there's one solution, but really, since we're a whole person that is very complicated and has numerous systems that have to work together to be functional, people need to look at themselves in that way.
I like that. It feels so much more accessible if I'm, dealing with a chronic illness. I'm starting to feel overwhelmed by all the things I have to be doing. You're saying, whoa, we can actually focus on maybe one or two things that feel easy for you to do or feel important to you. And then we actually see disease improvements in the disease status.
Correct.
Tell me, what does that look like? What are some examples of that? Or maybe what have you seen with people picking one or two things that we maybe think are not directly health related, but then they have a better outcome?
So physiatry is really an outcome or goal-based type of medical practice. We encourage our patients to set goals. And so if you really look at and start with that question, for someone, like, what is your real goal? In this case, the member wants to get their blood sugar down, to really try to go step by step and see what they're doing at home, whether it's keeping a food diary, an activity diary, a sleep diary, but really kind of helping them to analyze, what is it that I'm doing? Because day to day, people, if you don't record it, you can go through a day and not really remember what you did or what you ate.
Yeah.
So really kind of putting the ball in their court in terms of taking control in first, let's just see what you're doing. Not necessarily that you're doing something wrong. Let's just see what you're doing.
What you're doing to start out with. So
Correct.
maybe they say, all right, I get up, I have breakfast every day. I love to do my smoothie. It's got bananas and honey and some other things. We can make some adjustments to that, right? So we don't have to get rid of the smoothie.
Correct.
We could maybe change from bananas to a berry, which is lower sugar, easier for our body to digest. We could add more fiber, like adding oats. We could add a scoop of protein to it. Or we could even add a handful of spinach. So we're not neglecting what's already there or totally starting over. We're just kind of building on that. Does that sound right?
Yes, correct. And really focusing on what that person likes or what, is filling to them. Because when you tell people, I find to do something that's completely opposite or completely not something that they could see themselves doing, it sounds good, but that's probably usually where it stops.
Yeah, it's hard to implement that over
Right.
time, day after day, and keep
Yes.
doing it.
Yes.
It sounds like you're really talking about this idea of consistent small changes versus getting it perfect one time and trying to reach that every single day, getting it always perfect. What does that consistency or small steps look like?
Yeah, and really that helps people to have more success, in my opinion. The knowledge of being consistent and not perfect allows people to think that something's attainable. So changing one thing, let's say this is for someone who has high blood pressure and they use salt on everything. And you have them entertain the idea of what if for 2 days you didn't use salt, but you used a salt substitute. 2 days seems, manageable.
Yeah.
Not so horrible. It doesn't completely tell them don't ever eat salt again. 2 days, and then they say, well, it wasn't horrible.
It wasn't too bad.
I could see myself maybe doing that more often.
Or do it every other day.
Right.
Yeah.
And then just gradually increase the days. And over time, just as any habit, you're creating a habit. And eventually, if you're consistent with it, it then can become your norm.
Yeah.
So I think helping people see things in bite sizes makes it more feasible.
Yeah. One of my favorite examples that when I worked with clients, I would say is, when we have those meals that everyone loves, it's like rice and beans and tortillas, or we have a big bowl of spaghetti and we have garlic bread on the side. That's a really high carb meal, which can be kind of tough for disease management, especially for something like diabetes. That's okay. It's still a favorite meal. When you're doing the dishes, put some music on and just dance around the kitchen. You get more blood flow going. It helps with glucose regulation. So there's always something that we can do. We're not getting rid of those favorites or totally changing our life to try to get it perfect.
Yes.
We're just adjusting how we're already living so that we have more functionality and better outcomes.
Correct. And you brought up a good point about movement, because that's also part of it too. A lot of times, particularly with blood pressure and blood sugar, people focus on the foods, but movement has a key component to reducing those numbers as well. And it doesn't have to be something formal, something elaborate, a gym membership. It really can be as simple as turning on some music. Or really during a commercial break while you're folding clothes, you decide, okay, I'm going to do 10 squats, or I'm going to do 20 squats, or just something.
Or just some chair stretches.
Correct. Not necessarily some formal, well, I lift weights 3 times a week, or, something of that nature, because, I think that kind of takes away from the practicality of, in my opinion, if you eat every day, you should do some form of exercise every day.
Yeah, or even renaming exercise just to movement,
Correct.
which can feel more approachable.
Mm-hmm.
Yeah. Well, tell us, so Meridian has some ways that we can support disease management. One of those is through our care team. Can you tell us what it would look like for a member with maybe a chronic illness if they reach out to their care team? What can they expect?
Yeah, so a care team is a real asset, specifically to our health plan, but definitely for our members, because it used to be years ago, you see your doctor once a year, and then the other 364 days, you're left to tend to things for yourself, if you so choose to, honestly. And the care team is the bridge between that doctor and that visit, and carrying all the things that maybe were said during that visit and making it more practical in their home. So addressing their medications, what they should be taking, the consistency and how they should be taking it, in addition to food choices and movement, and then being consistent with their follow-up. I think the care team is a great bridge to help people become more engaged in their own care.
Excellent. Well, thank you so much for joining today and sharing some of those resources and your insights. If you would like more information, if you would like education on different disease states or ways that you can start some of those first couple steps towards wellness, you can check out our website. You can also get in touch with me, just like our listener, through our email address at eatwellbewell@mhplan.com. Those emails come right to me and I will respond right back to you. Stay tuned for more nutrition podcast episodes. And until next time, be well.